Imagine walking into a doctor's office, um, completely convinced you have adult ADHD. You've seen, like, all the viral online quizzes,
Yeah.
and the symptoms just line up perfectly.
Yeah, it feels like a slam dunk, right?
Exactly. But instead of handing you a simple checklist, the clinician asks to look at your recent blood work and wants to know about your hormones.
Which completely throws people off.
Oh, totally. Well, welcome to today's deep dive. Our mission today is to cut through the massive amount of noise surrounding ADHD testing.
Right, and we're using a really comprehensive guide from IN Focus First, which is a practice over in Carmel, Indiana.
Okay, let's unpack this. Because if you've ever felt overwhelmed by overlapping mental health symptoms, we really need to explore what a true psychological evaluation actually entails for adults.
Yeah, I mean, we really have to look past those viral online quizzes. They only ask what you are experiencing, but they never really ask why.
Which is a huge distinction.
It is. When we look at the adult presentation of ADHD, it's that quiet internal restlessness,
Hmm.
the chronic underachievement, poor time management.
Right, the stuff that doesn't just look like a hyperactive kid in a classroom.
Exactly. And according to the DSM-5, a diagnosis requires at least 5 persistent symptoms present before age 12, affecting multiple settings. But the thing is, those symptoms heavily overlap with severe sleep disorders or anxiety and depression.
Wow, okay. So if adult ADHD looks exactly like chronic anxiety or severe sleep deprivation, how does a clinician actually untangle that web without just guessing?
That is the million-dollar question.
Oh.
A proper assessment has to untangle that web using deep clinical interviews, cognitive tests, and collateral input from family.
Oh, okay. So getting into the whole history, not just the behavior.
Right, because as we age, our symptoms morph and the underlying causes get incredibly complex. You have to move beyond behavior and look at the physiology.
Which makes sense.
Yeah, and this is the exact puzzle Jessica Walsh is solving at IN Focus First.
And she's a psychiatric mental health nurse practitioner, right?
Yes, and she integrates psychopharmacology with metabolic health, inflammation, and hormonal contributors. She's actually pursuing dual certification in psychiatry and menopause medicine.
Wow, that's a really unique combination. But, I mean, if someone has had an ADHD brain their entire life, why are we suddenly interrogating their metabolic health at age 40?
Because the brain doesn't operate in a vacuum. Think about what happens in the body during major systemic shifts, like perimenopause.
Right.
A drop in estrogen doesn't just cause hot flashes. Estrogen is heavily involved in the production and regulation of dopamine in the brain. So when estrogen plummets, your dopamine is depleted.
Oh, wow. So suddenly that underlying ADHD you've been masking for decades just becomes severe brain fog.
Exactly, or severe executive dysfunction. The same goes for systemic inflammation, which actively disrupts the neural pathways associated with sustained attention.
Here's where it gets really interesting because standard care, just throwing a standard stimulant at it is basically like just resetting a check engine light.
Yeah, you can't just clear the code on the dashboard and hope the car runs fine.
Right. You have a systemic issue. This whole person approach actually checks the hidden wiring, like the hormones and the inflammation.
Which completely changes what happens after the diagnosis. You're finding the true source of that check engine light.
So it's not just about walking out with a prescription.
Not at all.
Yeah.
Medication isn't always the answer, or, well, not the whole answer anyway. Treatment becomes highly personalized.
It has to be if it's based on your specific body.
It really does. It often combines behavioral therapy, coping strategies, and targeted lifestyle changes based on your unique metabolic and hormonal profile.
So the goal is actual clarity and improved daily functioning, not just getting a label.
Exactly. And if we connect this to the bigger picture, it really makes you wonder.
Wonder about what?
Well, if ADHD symptoms are so deeply intertwined with our metabolic health, our hormones, and our neurobiology, how much of what we judge as our own personality flaws or laziness is actually just our biology asking for a different kind of support?
Wow. That completely shifts the perspective from self-blame to
It
self-discovery.
really does.
So if you are out there relying on an online checklist to figure out your brain, maybe it's time to step away and get a real look under the hood. Thanks for joining us on this deep dive, and we'll catch you next time.